Hey everybody, welcome to today's medical skit with Dr. Chinenu. Today, I want to talk about what I see all the times in patients with high blood pressure. Most people think they will feel it when their blood pressure is high, but that's one of the mistakes we make. The truth is, you feel absolutely fine while your blood pressure is damaging your heart, your kidneys, and even your brain. So let's talk about what you really need to know. Firstly, what you really need to know is what really hypertension or high blood pressure is. So high blood pressure, this is when the force of your blood against the artery walls is constantly high. Over time, this pressure makes your heart work harder, thickens your arteries, and make them lose elasticity like an old water pipe with constant stress. So, the normal blood pressure is below 120/90 millimeters of mercury. We start calling it high when it's consistently 140/90 millimeters of mercury or above. But remember, a single high reading doesn't always mean you have hypertension. We take consistent reading over several days. The second thing I want you to know is, why is hypertension called a silent killer? The reason why hypertension is dangerous, it's because it has no symptoms. You might not have headache, dizziness, or chest pain, whilst your arteries inside are dying, are damaged, slowly and quietly. It may lead to heart attack, stroke, kidney failure, or vision loss before you ever know something is wrong. That's why it's important for regular blood pressure check, even if you feel perfectly fine. What usually causes hypertension? Several things can raise your risk, like eating too much salt, loss of physical activities, smoking, stress, and even drinking alcohol frequently. And of course, genetics. If your parents had hypertension or they have hypertension, you are at high risk of developing hypertension. In Zambia and many other countries, diet is the most common cause of hypertension because we usually love eating salty food, processed snack, and even sugary drinks, which can raise the risk of developing hypertension. So then, how can we control the so-called hypertension? I have the good news for you. Hypertension can be managed and even prevented. Here are 4 to 5 manageable ways of controlling hypertension. Number 1, avoid too much salt. Before you eat your meal, make sure you taste the food before adding more salt. Number 2, avoid smoking and drinking. Number 3, maintain a healthy weight. Number 4, avoid stress. Did you know that your mind controls your heart more than you think? And of course, if your doctor prescribed BP medications, make sure you take them consistently. Did you know that BP medications, they don't cure the condition, they just maintain the numbers in their normal ranges. So please take your medication consistently. So remember, high blood pressure doesn't have to be a death sentence, but it can be deadly when ignored. It's a simple act that can save your life and the lives of those you love. I'm Dr. Daniel Chinenu. If you found this helpful, please share with someone who needs to hear it. Let's stay healthy together. Goodbye until next time.